Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test. Listening Test. Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Smith about Alzheimer's disease. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Smith. How are you today?
Good morning, Dr. Ellis. I'm doing okay, but I've been a bit worried lately.
I'm glad you came in. What's been on your mind?
Well, it's about my memory. Over the past few months, I've noticed that I'm becoming more forgetful. I sometimes forget where I put things, and there are times when I can't recall names or events that should be easy to remember.
I see. When did you first notice these memory issues?
It started around 6 months ago, but it seems to be getting worse. At first, it was just little things, like forgetting to turn off the stove or where I left my keys. But now, it's more frequent, and it's really starting to worry me.
Have you noticed any other changes, like difficulty finding the right words when speaking or feeling confused in familiar places?
Yes, actually. Sometimes I find myself struggling to finish a sentence because I can't find the word I'm looking for, and there have been a couple of times when I've felt disoriented while driving in my neighborhood.
That must be quite distressing. Have there been any changes in your daily routine or mood?
I try to keep things as normal as possible, but I have noticed that I'm more anxious than I used to be. I get frustrated easily, especially when I can't remember something simple. My daughter says I've been more irritable too.
I understand. Have you had any issues with performing everyday tasks, like managing finances, cooking, or taking medications?
Yes, I've had a few close calls. I've forgotten to pay bills on time a couple of times, and last week, I almost took the wrong dose of my medication. My daughter is helping me more with those things now.
I see. Has anyone else in your family noticed these changes?
Yes, my daughter, Emily. She's the one who urged me to come see you. She's noticed that I repeat myself more often, and that I sometimes seem confused.
It's good that Emily is supportive. Do you have any family history of memory problems or Alzheimer's disease?
My mother had Alzheimer's, and she started showing symptoms around the same age I am now. That's part of why I'm so worried.
I can understand your concern, especially given your family history. It's important that we take these symptoms seriously. Have you had any changes in your sleep patterns or experienced any depression?
My sleep has been a bit off lately. I wake up in the middle of the night and have trouble falling back asleep. As for depression, I've been feeling down, but I think it's mostly because I'm so worried about my memory.
That's understandable. Sleep disturbances and mood changes can sometimes go hand in hand with memory issues. We'll need to run some tests to get a clearer picture of what's going on. It might be helpful to do a cognitive assessment to evaluate your memory and thinking abilities.
That sounds like a good idea. I just want to know what's happening to me.
Of course, Mrs. Smith. We'll take this step by step. I'll also recommend some blood tests to rule out any other conditions that could be affecting your memory. And if necessary, we can discuss seeing a specialist.
Thank you, Dr. Ellis. I appreciate your help.
You're welcome, Mrs. Smith. We're here to support you through this. Let's start with the assessments and we'll take it from there.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Thompson about rusty nail. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Thompson. I'm Dr. Monroe, and I'll be taking care of you today. I see that you've come in because of a nail injury. Can you tell me what happened?
Afternoon, doctor. Yeah, it was a few days ago. I was doing some work in the garden, clearing out some old wood, and I stepped on a rusty nail. It went right through my shoe and into my foot. Hurt like hell.
That sounds painful. Did you get the nail out yourself?
Yeah, I pulled it out right away. There was a bit of bleeding, but I cleaned it up as best I could. I wasn't sure if I should go to the hospital, so I just bandaged it up and tried to keep it clean.
I see. And how has your foot been since then? Any signs of infection or worsening pain?
Well, it's been pretty sore, and I've noticed some swelling around the wound. It's also starting to look a bit red, and it's warm to the touch. I've been trying to stay off it, but it's hard with all the work I have to do.
It's good that you've been keeping an eye on it. The redness and warmth could be signs of an infection. Have you had any fever or chills?
I haven't noticed any fever, but I've been feeling a bit off, a bit more tired than usual, but I thought that was just because I've been working hard.
Fatigue can sometimes be a sign that your body is fighting off an infection. It's also possible that stepping on the rusty nail could increase your risk for tetanus. Do you know when your last tetanus shot was?
I was trying to remember that. I think it was quite a few years ago, maybe 10 or more. I'm not sure, to be honest.
If it's been more than 10 years, or if you're unsure, it's definitely time for a booster. We'll need to get that done today to protect you against tetanus. It's a serious condition that can cause muscle stiffness and spasms, and we don't want to take any chances.
I've heard about tetanus, but I didn't realize it was that dangerous. I guess I should have come in sooner.
It's understandable. Sometimes these things don't seem urgent at first, but it's always better to get them checked out. Besides the tetanus shot, we'll also start you on antibiotics to treat the infection. The redness and swelling you've described suggest that there could be a bacterial infection setting in.
Antibiotics? All right. How long will I need to take them?
Usually, a course of antibiotics lasts about 7 to 10 days, depending on the severity of the infection. We'll also want to keep an eye on the wound to make sure it's healing properly. If the infection doesn't improve in a couple of days, or if it gets worse, we might need to consider a different approach.
Okay. So, just keep taking the antibiotics and watch the wound.
Exactly. Keep the wound clean and dry. You should change the bandage daily or if it gets wet or dirty. I'll also give you some pain relief if the soreness is bothering you. If you notice any pus, increased redness, or if you start feeling unwell, you should come back immediately.
Will do, doctor. I'm usually pretty careful, but I guess I wasn't paying enough attention this time.
It happens to the best of us, Mr. Thompson. The important thing now is to prevent any complications. Do you have any other health conditions that I should be aware of? Diabetes, for example, can slow down wound healing.
No, I don't have any health issues like that. I'm generally in good health, but I do have some allergies to certain medications.
That's good to know. Which medications are you allergic to?
I'm allergic to penicillin. I had a bad reaction to it a few years ago.
Thanks for letting me know. We'll prescribe a different type of antibiotic for you to avoid any allergic reactions. There are plenty of options available, so you'll still get effective treatment.
All right, I appreciate that.
You're welcome. It's always important to mention allergies whenever you're being prescribed medication. Now, after the tetanus shot and starting the antibiotics, I'd like you to come back in about a week so we can check on the wound. Does that sound good?
Yes, that sounds fine. I'll make sure to keep it clean and follow your instructions.
Great. Just one more thing before you go, Mr. Thompson. Are you up to date on your other vaccinations, like the flu shot or the shingles vaccine?
I got the flu shot last year, but I haven't had the shingles vaccine yet. I wasn't sure if I needed it.
If you're over 50, it's a good idea to get the shingles vaccine. It can prevent a lot of pain and complications later on. We can discuss that at your next visit if you'd like.
I'll think about it. Thanks for the advice.
No problem at all. We'll take care of that wound today, and I'm sure you'll be feeling better soon. Take care of yourself, Mr. Thompson, and don't hesitate to come back if you need anything.
Thanks, Doctor. I appreciate your help.
You're very welcome. Take care, and I'll see you next week.
I will. Have a good day, Doctor.
You too, Mr. Thompson.